I just hit record and now I'm in the hot seat as the client.
All right. Hi, Keisha. My name is Lazan. I'll be your counselor today. Nice to meet you.
Hi, nice to meet you as well.
The message that you had left with my office indicated that you were having some issues with drug use. And so we're going to use this session today to just get to know you a little bit better and do a couple of screenings and inventories to see where you're really at.
Okay, sounds good.
All right. And you seem pretty calm today. You've had a good day so far?
Yeah, so far so good. I worked a grave shift last night, so I am a little sleepy.
All right, a little sleepy. All right. And other than that, you like your job? Work's going well? Things are going well?
Yeah, things are going pretty okay right now.
All right. And how would you, other than sleepy today, how would you describe your mood? Feeling irritated at all today, along with that sleepiness, anxious?
Not really, just mainly tired, pretty calm. Thinking about all of the stuff I have to read over the next week.
Right. Okay. And have you had any thoughts of suicide?
Nope.
None? Okay. How about any thoughts of hurting other people? Homicidal thoughts?
In my head and only with my ex-husband.
Oh. All right. Ever a plan or intent, means carrying anything out? No. Okay. All right. Any delusions recently? Ever?
Nope.
Any obsessions or phobias of sorts?
Mm-mm.
None? All right. And have you had any hallucinations or delusions?
Nope. No visions of Joan
None?
of Arc or anything.
None since coming into the session?
No.
All right. And can you tell me where we are, the time and the date of today as well?
We are sitting in your office at your counseling center. It's 9/28/18 and the time is 1:16 p.m.
All right. And can you tell me your full name?
Keisha Mystique Stephenson-Taylor.
All right. Thank you for that. And I'm just going to do a quick, just a memory test here. I'm going to say 3 words, okay? And then I'm going to give you a series of words, and you're going to tell me which one I definitely did not say, okay?
Okay.
All right. So we're going to say guitar, cat, mouse.
Guitar, cat, mouse.
Okay. Did I say water bottle at any point?
No, you did not.
What were the 3 words I said?
Guitar, cat, mouse.
Perfect. Thank you for that. All right. And so I'm going to move on, and we're going to do something called the Beck Depression Inventory. So like I said, your message that you left talked about a bit of substance abuse. So I want to go ahead and try to rule out a couple of things, or to see if there are any other issues that we should look into in our future sessions. That's okay with you?
Okay. Sounds good.
All right. This inventory has 21 questions. It's kind of on a Likert scale, so 0 to 3, 0 being like not at all, 3 being the most extreme of this. So the first one is sadness. 0 would be I do not feel sad. 1 is I feel sad much of the time. 2 is I'm sad all of the time. And 3 is I'm so sad or unhappy I can't stand it.
Probably about a 1.
A 1. Okay. And for pessimism, 0 is I'm not discouraged by my future. 1 is I feel more discouraged about my future than I used to be. 2 is I do not expect things to work out for me. 3 is I feel my future is hopeless and it will only get worse.
0.
Okay. And for past failures, 0 is I do not feel like a failure. 1 is I have failed more than I should have. 2 is as I look back, I see a lot of failures. And 3 is I feel I am totally failure as a person.
Oh, wow. Probably a 1.
A 1. Okay.
Mm-hmm.
And for loss of pleasure, 0 would be I get as much pleasure as I ever did from the things I enjoy. 1 is I don't enjoy things as much as I used to. 2 is I get very little pleasure from the things I used to enjoy. And 3 is I can't get any pleasure from the things I used to enjoy.
1.
1. Okay. And the 5th one is for guilty feelings. 0 is I don't feel particularly guilty. 1 is I feel guilty over many things I have done or should have done. 2 is I feel quite guilty most of the time. And 3 is I feel guilty all of the time.
2.
2. Okay. 6 is punishment feelings. 0 is I do not feel I am being punished. 1 is I feel I may be punished. 2 is I expect to be punished. And 3 is I feel I am being punished.
0.
Okay. For self-dislike, 0, I feel the same about myself as ever. 1, I have lost confidence in myself. 2, I am disappointed in myself. 3, I dislike myself.
I'd say 0.
Okay. For self-criticalness, 0, I don't criticize or blame myself more than usual. 1, I'm more critical of myself than I used to be. 2, I criticize myself for all of my faults. And 3, I blame myself for everything bad that happens.
2.
2, okay. And number 9, suicidal thoughts or wishes. 0 would be I don't have any thoughts of killing myself. 1, I have thoughts of killing myself, but I would not carry them out. 2, I would like to kill myself. 3, I would like to kill myself if I had the chance.
0.
0. All right. And 10, crying. 0 would be I don't cry any more than I used to. 1 is I cry more than I used to. 2 is I cry over every little thing. And 3 is I feel like crying, but I can't.
0.
0. Okay. Number 11, agitation. 0, I'm no more restless or wound up than usual. 1, I feel more restless or wound up than usual. 2, I'm so restless or agitated that it's hard to stay still. 3, I'm so restless or agitated that I have to keep moving or doing something.
1.
1, okay. 12 is loss of interest. I have not lost any interest in other people or activities is 0. 1 is I'm less interested in other people or things than before. 2 is I have lost most of my interest in other people or things. And 3 is it's hard to get interested in anything.
0.
0. All right. 13, indecisiveness. 0, I make decisions about as well as ever. 1, I find it more difficult to make decisions than usual. 2, I have much greater difficulty in making decisions than I used to. And 3, I have trouble making any decisions.
0.
0. All right. 14, worthlessness. 0, I do not feel I am worthless. 1, I don't consider myself as worthwhile and useful as I used to. 2, I feel more worthless as compared to other people. And 3, I feel utterly worthless.
0.
0. Okay. 15, loss of energy. 0, I have as much energy as ever. 1, I have less energy than I used to have. 2, I don't have enough energy to do very much. 3, I don't have enough energy to do anything. 2?
Yep.
Right. 16, changes in sleeping pattern. 0, I have not experienced any change in my sleeping pattern. 1A, I sleep somewhat more than usual. 1B, I sleep somewhat less than usual. 2A, I sleep a lot more than usual. 2B, I sleep a lot less than usual. 3A, I sleep most of the day. And 3B, I wake up 1 to 2 hours early and can't go back to sleep.
Probably 3, the one where I wake up and can't go back to sleep.
Okay, that's 3B. All right, for irritability, 0, I'm no more irritable than usual. 1, I'm more irritable than usual. 2, I'm much more irritable than usual. And 3, I'm irritable all the time. 2? Okay. 18, changes in appetite. 0, I have not experienced any change in my appetite. 1A, my appetite is somewhat less than usual. 1B, my appetite is somewhat greater than usual. 2A, my appetite is much less than before. 2B, my appetite is much greater than usual. 3A, I have no appetite at all. Or 3B, I crave food all the time.
Probably a 0. My appetite's been pretty much the same as always.
All right. And concentration difficulty. 0, I can concentrate as well as ever. 1, I can't concentrate as well as usual. 2, it's hard to keep my mind on anything for very long. And 3, I find I can't concentrate on anything.
2.
2?
Mm-hmm.
Okay. And tiredness or fatigue. 0, I'm no more tired or fatigued than usual. 1, I get more tired or fatigued more easily than usual. 2, I'm too tired or fatigued to do a lot of things I used to do. And 3, I'm too tired or fatigued to do most of the things I used to do.
Probably a 1.
1, okay. And the last one on this inventory is loss of interest in sex. 0 would be I have not noticed any recent change in my interest in sex. 1 is I am less interested in sex than I used to be. 2 is I am much less interested in sex now. And 3 is I have lost interest in sex completely.
0.
0. All right, let me take a quick moment and score this.
Okay.
All right, and all right. Okay, you scored an 18 on this depression inventory, and that is on the moderate range. So 17 to 20 would be borderline clinical depression. And since you are right on the cusp, so a 16 would have been a mild mood disturbance. We can definitely monitor this and discuss this more in future sessions and see if this is a current concern of yours or something that needs to be taken care of. Okay. All right. And the next inventory we're going to do has to do with anxiety. There's a list of 21 things I'll read off. And basically the scale is from not at all to mild to moderate to severe. So I'll just list a feeling or something along those lines, and you'll just let me know. If it's not at all, you can just say not at all, and I'll mark it. If it's mild, moderate, severe, just let me know. Okay?
Sounds good.
All right. The first one would be numbness or tingling.
Not at all.
Not at all. Okay. Feeling hot.
No, not at all.
Wobbliness in legs.
No.
All right. Unable to relax.
Moderate.
Okay. Fear of worst happening.
Moderate.
Okay. Feeling dizzy or lightheaded.
Not at all.
Okay. Heart pounding or your heart racing.
Mild.
Mild. Okay. Feeling unsteady.
Not at all.
Not at all. Okay.
Not at all.
All right. Feeling terrified or afraid.
Not at all.
Not at all. Okay. Feeling nervous.
Mild.
Mild. Okay. Feeling like you're choking.
Not at all.
Okay. Your hands trembling or shaking.
Not at all.
All right. You feeling shaky or unsteady.
Not at all.
Okay. A fear of losing control.
Severe.
Severe. Okay. Difficulty in breathing.
Not at all.
Okay. Fear of dying.
Not at all.
Okay. Feeling scared.
Mild.
Mild. Okay. Any indigestion or stomach issues.
Mild.
Mild. Okay. Any fainting or feeling lightheaded.
Not at all.
Okay. And your face being flushed.
Not that I've noticed, so not at all.
Okay. And any hot or cold sweats.
Not at all.
All right. I'm going to take one moment to score this one as well.
Okay.
right, you scored an 11. And that's on the lower range is 0 out of 21 would be low anxiety. And so you did pretty well. If things do change over time, we can always go back and do this inventory if you are feeling more anxious than usual. And we can kind of see if there are any patterns or trends after that. The last inventory I would like to go through, it's called the drug abuse screening test. I know you signed some forms before you came in letting you know that this is confidential, but I just want to reiterate the fact that, you know, anything you say just stays in this room unless you mention harming yourself, someone else, child or elder abuse. So, all right. And this will be 28 questions and just a yes or no answer for these. Okay. Ready? All right. Have you used drugs other than those required for medical reasons?
Yes.
Okay. Have you abused prescription drugs?
No.
Okay. Do you abuse more than one drug at a time?
No.
Okay. Can you get through the week without using drugs other than those required for medical reasons?
No.
Okay. Are you always able to stop using drugs when you want to?
Yes.
Okay. Do you abuse drugs on a continuous basis?
Yes.
Okay. Do you try to limit your drug use to certain situations, like when you're at a party or if you're home alone?
No.
No? Okay. Have you had blackouts or flashbacks as a result of drug use?
Yes.
Yes. Okay. Do you ever feel bad about your drug abuse?
No.
No. Okay. Does your spouse or parents ever complain about your involvement with drugs?
Yes.
Yes. Okay. Do your friends or relatives know or suspect your drug use?
Yes.
Okay. Has drug abuse ever created problems with your spouse?
Yes.
Has any family member ever sought help for problems related to your drug use?
Yes.
Okay. Have you ever lost friends because of your drug use or drugs? Okay. Have you ever neglected your family or missed work because of drugs?
No.
Okay. Have you ever been in trouble at work because of drug abuse?
Yes.
Okay. Have you ever lost a job because of drug abuse?
Yes.
Okay. Have you gotten into fights when under the influence of drugs?
No.
No? Okay. Have you ever been arrested of unusual behavior while under the influence of drugs?
Yes.
All right. Have you ever been arrested for driving while under the influence of drugs?
No.
Okay. Have you ever engaged in illegal activities in order to obtain drugs?
No.
Have you ever been arrested for possession of illegal drugs?
No.
Have you ever experienced withdrawal symptoms as a result of heavy drug intake?
Yes.
Okay. Have you had medical problems as a result of drug use, memory loss, hepatitis, convulsions, bleeding, things like that?
No.
Okay. Have you ever gone to anyone for help about a drug problem?
No.
Okay. Have you ever been in a hospital for medical problems related to your drug use?
Yes.
Okay. Have you ever been involved in a treatment program specifically related to drug use?
No.
Okay. And have you been treated as an outpatient for problems related to drug use?
No.
All right, that was the last one. I know that was a bit much to get through, John, and thank you for that. I'm going to take a moment to score this
Mm-hmm.
and let you know. Okay. All right. Well, you scored a 12, and anything over a 12 would be considered a drug abuse problem. But since you do fall right on the cusp, that cutoff, we can definitely do more screenings for it, and we can definitely discuss it more in future sessions. But it's something we'll definitely have to monitor, and I'm sure the more sessions we have, the more we can discuss how this is affecting your life and the best treatment plan for this as well. I just want to thank you for everything. I know these screenings and these inventories are a lot, but these will really allow me to get a clear sense of the picture. I don't know if there's any questions you have on anything you answered today, anything along those lines.
No questions today.
All right. Well, I just want to thank you again. And in the meantime, please let me know if you feel like there's any changes with any of the answers you provided today, or if there are any inventories you would want to go over and answer differently in our next session or future sessions. And I look forward to seeing you again.
All right. I'll see you next week.
Thank you. See you next week. Bye.
All right. Wow, that was interesting.
I'll leave and come back so it stops.
Okay.